Uh, Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Chromulin series. This audio podcast is part of a Spectro integer, and this audio podcast series as part of a Storm Robotics production. Today, now looking at looking at uh, looking at hematuria, where hematuria is or can be associated with chronic kidney disease or CKD. Again, this audio podcast as part of this series from works published works from 2015 looking at hematuria and testing to improve patient outcomes. Um, so uh, Hematuria can provide an index of glomerular basement membrane thinning, but renal specialists need to devote more attention to the presence of protein leaking in context of renal pathophysiology into and so recent reports or recent investigations, however, have propelled hematuria into the vanguard of clinical nephrology. If severe or sufficiently progressive hematuria can be indicative of AKI, acute kidney injury, and also eventual CKD or chronic kidney disease. Moderate to severe CKD is also associated with an increased risk of other significant adverse outcomes, and the risk of developing CKD increases with age. As renal dysfunction progresses, coexisting conditions become more common and increase in severity. CKD can progress to ESRD or end-stage renal disease or end-stage kidney disease (ESKD) in a small but significant percentage of the population. And although usually asymptomatic, when no symptoms, no symptoms are where no symptoms when no symptoms exist, CKD is detectable, and investigations are simple. Investigations tend to be sorry preliminary investigations tend to be simple and broadly available. The investigations are additionally is where the as where is where as where and so where exists where evidence exists aligned with treatment pathways. This can prevent or delay the progression of CKD, chronic kidney disease, reduce or prevent the development of complications, and also reduce the risk of other sort of known and published primary conditions. However, CKD is often recognized because there are no specific symptoms, and is often either undiagnosed or diagnosed uh, at an advanced stage. Over the years, collaborative efforts facilitated by common definition of CKD have provided a description of epidemiology and natural history of this disease, which has improved understanding of the pathophysiology involved. There is increased recognition that CKD, chronic kidney disease, is encountered in multiple settings and in all age groups, and that its course and outcomes are influenced by the severity and duration of the event. The effect of CKD on an individual recipient and the resulting societal burden that ensues from the long-term effects of the disease or condition is and has attracted increasing scrutiny. There is evidence of marked variation in the management of CKD due to a lack of awareness and absence of standards for prevention, early recognition, and intervention. The emerging data point to an urgent need for a global effort to highlight the fact that CKD is preventable. Its course is modifiable, and its treatment can improve outcomes. Analysis of patients with or recipients with unidentified CKD suggests that their risk profile may be different to recipients with identified CKD, and is an area that requires further research. That draws this audio podcast to a close. This audio podcast as part of a Chromulin series. This audio podcast as part of a Spectro Integer, and this audio podcast as part of a Storm Robotics production.